This is All Out Politics, news, debate and opinion from the heart of Westminster. Jeremy Hunt has passed a milestone this week. He is now the longest-serving Health Secretary, clocking up close to 6 years in the job. Hasn't, of course, all been smooth going for Mr Hunt, who's weathered countless political storms since taking up the position in September 2012. So today we're asking, how is he doing? Has he done a good job? To discuss that, I'm joined here in Westminster by the Shadow Health Minister, Justin Madders, by the Director of the Westminster Policy Institute and former advisor to David Cameron on health policy, Sean Worth, and in South East London, Dr Louise Irvine, a GP and a member of the National Health Action Party. And Dr Irvine, you actually stood against Jeremy Hunt for Parliament, so presumably you don't think he's doing a great job.
No, I don't, actually. I think he's doing a really terrible job, and it's really shameful. We look at all the performance in hospitals, in general practice where I'm working, in mental health. Everything is getting worse year on year, and this winter was one of the worst crises ever, with people actually died in hospital corridors on trolleys. He doesn't take responsibility for this deterioration in the NHS. He tends to do things like just blame winter, or blame the fact there's too many old people now, or he just makes out that this is something that just happened, whereas it's all been totally predictable. Every single bit of deterioration is on a downward trajectory, could have been predicted, could easily have been planned for. None of his plans, he hasn't got a plan to actually sort out the NHS at all. It's been underfunded, it's being progressively outsourced, which is just causing huge waste. He's lost the confidence of NHS staff. Doctors and nurses don't trust him, they don't believe him. And really, any other government, he represents the government, so it's not just Jeremy Hunt. They could change the Health Secretary tomorrow. It would still be the same issue. This is government policy, which is running down the NHS and undermining it. And I really fear for its future if this continues.
OK, Sean Worth. There you are. There's the case against Jeremy Hunt and the government, indeed, which you advised.
Yeah, I mean, is he doing a good job or not? Yeah, first test I think is of time. Politically, I think he's weathered quite, as you've said. There's been quite a lot of pressure on the NHS. What you didn't hear there was that the last winter pressure, it was the biggest winter pressure that the NHS has faced for years. So of course you get huge problems in those sort of scenarios. Funding has been a really difficult issue for the NHS. It's now doing more operations, it's got more staff than ever before. It's a bigger service than it's ever been, under more and more pressure. Having handled that politically reasonably well, I think, the big test for him now is this debate that he's currently involved in about whether we can have a proper step change in funding. And I think if he, I think just to finish that point, if he does get that through, I think that would be a serious legacy that he's pushed through there.
Do you accept Dr Irvine's point there about deteriorating service across the board? Do you think that's fair? Because government keeps on saying, actually, the health service is performing at record levels in many areas.
I mean, if you look at it, genuinely, if looking at this objectively, I know that there are interests here in kind of being a lot more politically biased, but looking at it genuinely objectively, the service is under massive pressure, under pressure that it's not faced ever before in its history. So it is under huge pressure. I think that the two things Jeremy Hunt has brought in very briefly, first of all, the focus on patient safety. He's been, I think, the first health secretary that's admitted cover-ups and things that have gone wrong and trying to put that right. So he's got a lot of, I think, plus points for the kind of compassion side that he's shown. But the funding issue is genuine and real, and he, in government, is now trying to push for a bigger settlement. He's got a bit of a fight with the Treasury, but it'd be really interesting to see if he wins that.
Justin Madders, I mean, he famously refused to be moved from the health department. He said that it's his last job in politics. I mean, just personally, do you have any sympathy or respect for the way he's handled things?
Well, as a human being, of course, I have no particular qualms with him, but I think if we look objectively at his own performance on the government's own targets and stats, that they're failing to meet just about everyone. And as the doctor just said, the winter crisis is a perfect example of where he's failed. So if we look back to last year, the 2017 winter crisis, we had the Red Cross calling it a humanitarian crisis, and he said at the time clearly this was unacceptable and we've got to do something about it. But we fast forward to this year, it was even worse. It was the worst on record, and we had 68 A&E consultants writing to the Prime Minister saying that they couldn't guarantee patient safety. We had a doctor apologising for what he considered to be third world conditions in A&E. And if you go to March of this year, which is when we would have hoped to have been over the worst of the winter crisis, we had over 300,000 people waiting more than 4 hours to get into A&E. And that, actually, if you compare to when he started, that's an increase of 842%. He's had the opportunity to put things right, and things have actually got worse.
Well, has he had the opportunity to put things right? Because, I mean, you, as you know, Labour as a putative government, you know, you've got to think about the money, where the money's coming from, and you can't promise sort of unlimited funding for the NHS, can you?
Well, no party can promise unlimited funding, but I think when there's a problem with a particular part of the service, as there is every year in A&E, and the government make a commitment to actually try and put things right and they get worse, you have to say, well, the responsibility has to start with someone, and it has to be him.
Not just the overall spending level.
Well, the overall spending budget is a problem as well, and you've got to look at things in that context. But actually there was then a political push from him, and I think the government accepted that something needed to be done. But actually things went backwards in the 2018 winter period, so he's got to take responsibility for that. That's what politicians should be doing.
Dr Irvine, I mean, you said, oh, they could just replace him with someone else, but isn't one of the sort of grudges, if you like, that people with an interest such as yourself and other health workers have against Jeremy Hunt is he actually has got on top of it. He's beginning to understand how the health service works, so he can't simply, as we saw with the junior doctors, be used as a whipping boy.
Well, he wrecked his relationship with the junior doctors, and he has a terrible relationship with NHS staff and with nurses, so I don't think that's a success. I think it's outrageous for him to be claiming to be the champion of patient safety when he is presiding over a real deterioration in services that actually impact on patients. There were 80,000 people lying on hospital trolleys in April. That's 4 times the number in April 2013. This is the most unsafe place to be in a hospital. You can't get properly monitored or treated. People died there. There were 10,000 excess deaths in the first few months of this year, which are attributed to social care cuts. I can't get my children who are severely depressed or suicidal, they don't get treatment in time. That's not safe. So the idea that there's somehow this amazing patient, he's an amazing patient champion, is such a part of PR and spin. And that's the reason he's been kept on. Apparently he's got 24 people, press officers helping him. He's very good at deflecting criticism from the government. He's very good at sort of throwing his hands in the air and say, oh, unprecedented levels of demand. Actually, no, they're all predictable. The number of people using A&E has just gone up regularly with the rise in population.
I mean, they may be predictable, doesn't mean they're not unprecedented, and it doesn't mean there isn't a shortage of money Stuart Stevens was given the money that he asked for, and then he came back and said he needed more.
Yeah. He wasn't given the money he asked for, and that's another bit of spin. He said at the very minimum we could try giving us 8 billion extra by 2020, and we will then have to make cuts and efficiencies of 22 billion by 2020. And he said he was not sure the NHS would be able to do that because it's already been squeezed to extreme point, and you would need to invest hugely in social care, which has not happened. And you'd have to have invested hugely in preventative care and public health. In fact, public health is being cut. So the conditions that Simon Stevens gave for possible efficiencies have not been met. And it's a complete lie to say that the NHS has been given the funding it needs. It's had something like flatline funding per person this decade. That's the truth. Every other advanced economy increases by 3 to 4% per year. That's the average increase we've had since the NHS was founded. Under the Labour government in the 2000s, it went up by 6%. And you did see a difference in... I was a GP then, and you did see a difference in waiting.
I think you'll find actually that the thing spikes and goes down, but I just want to put your points there, since this is a discussion, to Sean Worth. Sean Worth, a suggestion that there's a lot of blame shifting and spin coming out of Jeremy Hunt, that's what the doctor associates with him.
Well, the government has put its view forward. I know the government will say The NHS is under unprecedented pressure. The winter crisis we've just been hearing about, the stats coming from that, what they don't say is it was the biggest winter pressure for very many years. That's the sort of objective view, right? Now, on the point about patient safety, that's an interesting one because I think Jeremy Hunt is probably he is the first health secretary that has said, I'm not tolerating the kind of culture of cover-ups and blame and spin, which was actually within I'm not blaming the NHS.
Yeah, but the doctor would say that would actually be shifting the blame. He's responsible, but he's pointing the finger
The Mid-Stafford NHS, the Mid-Stafford report said there's been a culture of cover-ups in the NHS which can no longer continue. He's been the only health secretary brave enough to come out and deal with that. Now, that doesn't make the government look good. That's the right thing to do.
I mean, when you hear all this, doesn't it make you a bit worried you might win the election and have the responsibility for running the NHS?
Well, I just look back to the condition the NHS was in 1997 when we took over. It was really on its knees, and we've turned it around. So by the time we left office in 2010, we had record satisfaction levels. So if you look back over time, history has shown that a Labour government will always improve the NHS.
OK, thank you, all three of you, for joining us. This is All Out Politics. Coming up next...